Today we are talking about postpartum reality and having some nitty-gritty, messy kind of real talk here. So not from the pack up, but we are still focusing on some of that postpartum experience. I am Meaghan Grant. Now that we've fixed that mistake, I am one of the owners of Toronto Family Doulas of Ottawa, and Hamilton Family Doulas. And I have been a doula and childbirth educator for 8+ years now. So that is an awfully long time for a doula. And so obviously today we are going to be I'm talking with Leanne, and we're going to talk about all of that stuff that nobody tells you about after having a baby, because once you have the baby, everybody's super interested in the baby and what the baby's doing and how the baby's sleeping and how the baby's eating and how your body is helping the baby, but not so much about your body.
Yeah. Or there's going to be some concern. So here's my first rude awakening after first realizing that I was going to bleed for a month or more. So for up to 6 weeks, women get this lochia, as you know, Meaghan. And this is like a period. It starts off like a period on steroids. It's quite heavy bleeding, usually in the first day or so. It ramps down to about a moderate period after a couple of days. And then it lasts like that for a week or two as it gradually sort of reduces in volume until the last couple of weeks. You might just have some spotting. You might even go for a day or two between spotting. And at that point, sometimes the spotting really means yo, slow down. You're too busy. Yeah. But so my first crazy thing with the lochia, aside from the fact that when I had to get out of the hospital bed to go to the bathroom, when most of us who deliver in the hospitals end up staying there for a day or so. And so, there's definitely going to be points where you're hopping out of your hospital bed trying to get to the bathroom. But I would find that there was so much blood on that first night that I would start planning, okay, swing your legs over, shift your weight to your feet before you stand up. And then as soon as you stand up, run like hell to the toilet while putting your panties down. So that I didn't leave, because the first time I did this, I left a giant trail of blood on the floor and had to call a nurse to find someone to come clean it. It was embarrassing for me. And it was shocking that much blood was coming out of me. The next thing was in the middle of the night. So I had my baby first thing in the morning. I go through the whole day where I'm trying to get to the toilet a bunch of times. And then I'm sleeping at around 2 a.m. Both me and the baby are sleeping on this hospital bed. I'm on my side. A nurse comes in, pulls down the sheet. She doesn't say anything because she thinks I'm asleep. She pulls down the sheet.
Because that's not disturbing at all that we're going to remove someone's coverings and look at their genitals while they're asleep.
She just hooked her fingers into the panties, those cool panties, and sort of pulled them away. And I said, "What's going on?" And she said, "I'm just looking at you bleeding, hon," and then left. And I guess my bleeding was in range because she wasn't freaked out that there was too much of it or there weren't giant clots, because that's a thing that generally happens in the first few days, is big old livery clots. And so, yeah, hey, welcome to brand new motherhood. Why don't we just make it look like a horror show happened in your hospital bed?
So you want to know the worst part? After my second, my lochia lasted for 3.5 months.
Oh, no.
So I, of course, then have to go for ultrasounds to make sure that there isn't retained placenta. There was this whole thing we had to go through. And of course, that also, for anybody who is wondering, because there are then questions that delayed things like placing an IUD. So now my birth control was up in the air. So yeah, and it was just the inevitable sort of conclusion was just everybody sort of went, well, your body just responds really aggressively to hormone swings and it's not happy with this one. So yeah, lochia, like average and normal is that sort of 4 to 6 weeks. There are the occasional outliers, and it sucks to be one of them. But really important to note that I did follow up with my OB. I did check in with my doctors to make sure that what was happening was normal. We continued to follow up with testing, because as much as in my case it ended up being perfectly benign, there are also times where it's not. So, as we're talking about and you mentioned sort of the clots. This is for me, the biggest thing, the biggest surprise about lochia is, as you said, sort of the volume. And I didn't really have a good concept of what was normal and what wasn't. And so they would always say, like, oh, if you fill a pad in an hour or less. And I was like, okay, but are we talking about a panty liner or an overnight maxi pad? Like, what are we talking about here? Because that's a big range that we're discussing.
In the first few days, it's kind of normal-ish to fill a pad in an hour or so. Like that, there really, truly is quite a lot of bleeding for some women. Some women I talk to, some of our clients say, like, oh, my bleeding wasn't so bad. And because I'm always like, buy the plus size overnights, extra long with wings all night.
No wings, wings leak. Depends. Depends on where it's at. That was actually part of today when I was making my notes for this. I was like, okay, I got to give people some hope here. We need some, like, tips on how to make this easier. And honestly, when it comes to lochia, the best tip I can give you is skip the pads entirely, at least for the first week. Depends are your friend. I know that was maybe not what you were anticipating in your 20s, 30s, and 40s. But let me tell you, it makes life way easier. And I will tell
they're cute now.
Honestly, I don't care whether they're cute or not. They are so much more comfortable.
Yeah, they are. They're more comfortable. But what my client, because obviously maybe it's not obvious, I'm well beyond childbearing age. Like I've got there's no more eggs in my fridge. So for me, I'm a little removed from a couple of the innovations that are happening, and I often learn about new things that are out on the market from our clients. And one of our clients recently was like, oh, I just bought Depends. They're so cute. They're like little pink panties. And I thought, oh, well, that's awesome that they're making them adorable.
One of the things that's nicest about them, because I've had a lot of clients who are like, well, but don't I get a pair at the hospital? Well, you do, but you get one pair of reusable mesh panties, or you can pay through the nose for more. And I mean, I'm talking, because then you use pads on top of it. Like, the mesh panties aren't the actual absorbent material. They just hold the absorbent material in place. So they're like $5 to $10 a pair, depending on the hospital you're at, which is 3 times the cost per Depends. And the Depends are way more comfortable because Depends are sized. So for those of us that are not a size 6 and we sort of ignored the gym our entire pregnancies, myself included, maybe those mesh panties aren't the most comfortable things in the world. They roll. I also found, I know people swear by them, but I found them uncomfortable. I found the tops rolled and sort of like dig in. And because I had a really intense labor the first time and a fairly quick labor the second time, I had a lot of sort of abdominal just pain and discomfort. Like, I felt literally like I'd been hit in the abdomen by a Mack truck. So that, like, digging in it all was just not comfortable, and it felt gross. It made me feel gross. And I was like trying to latch the baby and hike up the underwear, and it just didn't work. And so I am a huge fan of Depends. I mean, I, again, never thought I'd say that in my 30s. I say a lot of things on this show I never thought I'd say.
So the only time I've had to use Depends in my life, or chose to use them, was during my second pregnancy. I got bronchitis so bad that every single time I coughed, I voided my bladder completely. Like, I just peed myself. As a woman, in like a 36-year-old woman, I just peed my pants every time I coughed. And of course, when you have bronchitis, you're coughing like 20 times a day. So yeah, I wore Depends. I had them for a really long time. And I used up the last couple, like when we were toilet training one of the kids. I was just like, put this in your underwear.
Well, and I mean, I'll point out, and this is something, please, for everyone who's curious about pelvic floor physiotherapy, we've had a couple of episodes on this, but definitely not something that would have been a casual conversation with your care providers when you were pregnant with your kids. That's a much newer recommendation. Yeah. And even now, I'll say, I hear the majority of medical professionals recommending pelvic floor PT postpartum versus doing so during your pregnancy. But obviously, there are a lot of benefits at any stage. Absolutely. And so, you know, if you were having that experience now, we'd still say Depends, but we'd also say get some additional help for that. Maybe not so much when your kids were still... Yeah. But so that's lochia. And obviously, like, this is something that can surprise people, both in the amount, the clots, the size of the clots, just sort of like the facts and the nitty gritty of this. This is caused because the placenta comes away from the uterine wall, and it actually leads. I should have brought my placenta, my stuffed placenta, for the record. The placenta comes away from the uterine wall, and it leaves a placenta-sized wound. And this is actually one of the other things nobody told you about postpartum. Your baby coming out is not the end of your contractions.
No.
Insult to injury here, your contractions continue, and they continue until your uterus goes from roughly the size of a watermelon, which is, you know, the fundal height, up to approximately your diaphragm. There's the placenta that comes away from the uterine wall, and it leaves a wound about the size of that placenta.
It's huge.
The contractions are actually helping to shrink the uterus down, and that helps to contract the size of the wound. The thing to know about that is these contractions are exactly the same as your contractions during labor. They are a result of oxytocin. What else uses oxytocin in the postpartum period? Breastfeeding your baby.
Yep.
If you are breastfeeding, you are going to experience, you're really probably going to feel them. And for those of you who sort of vaguely kind of remember them from your first baby and now you're expecting your second, real insult to injury, everything typically goes a little bit smoother and faster in labor the second time around. It's kind of like
this.
It's kind of like your uterus is like, oh, I've been here, I've been there, done that. I know what I'm doing here. Except this part, the after pains part, these after birth contractions get worse with every single pregnancy and every single birth. Yeah. So the more babies you have, the more these suck. I'm going to warn you, they don't give you an epidural for this in postpartum. I know because I asked. And I like the second time around in particular, I really felt those contractions. And when you feel them the most strongly is when that nipple stimulation is happening from baby being latched or from a pump, either or. Even a haka is enough to potentially do it because it is giving that little bit of draw, that little bit of suction, which is potentially triggering an oxytocin release. And so that is helping to contract your uterus down. It still takes about 6 weeks from the birth of your baby for your uterus to reach its pre-pregnancy size. And simply because I know that very few women have actually been taught enough about their own bodies, pre-pregnancy size of a uterus is approximately the size of a fist. So you are going from large watermelon to this in about 6 weeks. And you will feel a lot of those contractions. Now, the further out from birth you get, the less intense they are, the smaller the uterus is at that point, the more comfortable it is. Keep in mind, and this is really important, the uterus is a muscle. I think a lot of us have this idea it's an organ because something is inside of it, but it's actually a muscle. So those muscle contractions are no different than if you were exercising and feeling a muscle contraction, or if you were having, you know, a Charlie horse and a muscle spasm, same idea. The uterus is doing that, and it's doing it because A, it needs to go back to its pre-pregnancy size, but also to help close and reduce the size of that wound, which can help with bleeding. This is why, for anybody who is aware, people who know what a fundal massage is, it is the least fun massage you will ever get in your life. This is a very aggressive massage on the uterus shortly following the birth of your baby. And that's to help stimulate those contractions, because sometimes the uterus goes, I've done my job, I'm done. And really it's not. So you get this fundal massage from the nurses in order to help stimulate those contractions and bring that bleeding under control very, very quickly. Then that sort of lochia kicks in and you have that ongoing bleeding. Important to remember, lochia is really important. We don't want lochia to stop prematurely. It is actually helping to flush everything out of our bodies. And as someone who experienced infections after both births in my uterus, you really want all of that flushing to happen because postpartum infections suck. But lochia is just sort of like the first surprise when it comes to having a baby. And anybody who's worked with me will hear me say that hormones are the trippiest drug you will ever be on. Everything in the postpartum period really comes back to hormones. And during your pregnancy, your estrogen levels are quite high. This is helping to sustain your pregnancy. You give birth, your estrogen drops substantially, in part because your ovaries and your reproductive system have basically shut down during your pregnancy, and that's where the majority of your estrogen production happens. So in those sort of first weeks and months postpartum, your estrogen levels are much lower than they have been up until that point. And one of the first ways you're going to see that is all that beautiful, thick, luscious hair you've had your whole pregnancy. I liken it to the cartoons when the birds go with the feathers and they go poof, and then they just sort of like sit to the ground. That's kind of what your hair is going to do. It is going to fall out. Not all of it. You mostly likely won't go bald. There are people who experience significant postpartum hair loss, but typically you're going to just be losing what you would have lost the previous 9 months and didn't.
Because what's going on is, as those estrogen levels spike in pregnancy, your body, like one of the side effects, this is one of the cool things about hormones. They have all kinds of these funky little side effects that most of us aren't really aware of. So one of the side effects of really high levels of estrogen in pregnancy is that your body doesn't shed all the extra hair. You have a cycle and it goes, it takes a few months to go through the cycle where you grow a hair, that hair matures, and then the
little wispies.
Yeah, and then the follicle lets go eventually, right? So your hair is constantly going through this process, except in pregnancy when it retains all those hairs. So if you're shedding hair in pregnancy, it's from breakage. It's not because the follicle is letting go. And if you're worried about, in postpartum, all that when you're combing your hair and the hair is coming out, it's really just the follicles that didn't release during pregnancy. So while you may look in places like you might get a bit patchy, and generally, it can get thin, but it usually doesn't look like that. Some women in menopause can start to lose more hair because their estrogen levels really drop super duper low, and their testosterone levels start to rise higher. And so that can cause a lot of hair loss. So we often see much, much older ladies, beautiful, 70, 80-year-old ladies, and they just have little wisps of hair left. And it's usually not that bad. If it is that bad for you, you can definitely go to talk to your doctor about potentially getting an estrogen cream or something to help to boost your estrogen levels. And that'll help to retain some more of your hair follicles. But yeah, that's what's going on. And your hair will just continue to grow. You'll probably have thin, slightly wispyish hair, and it will start to thicken up over the course of the next year. I mean, it's not perfect, and it might look like shit for a little while, but it's one of the natural things that happen. And I always find all the weird body stuff is super fascinating. So I find this super fascinating, even though it's kind of not fun.
Well, and it affects so much more than the hair. This major drop in estrogen is sort of the instigator in so much, honestly, of the postpartum experience. And one of the other ones that people are surprised by, and this one doesn't happen to everyone, just like the hair loss, everyone will experience hair loss, but some will experience it more than others. Acne. Postpartum acne is a thing. And I remember being sort of a little WTF about it all, because I was like, I'm not 14 anymore. This is ridiculous. But the acne was real. And again, it's linked back to these, shifting hormones, this estrogen that comes into place. And so one of the, keeping all of that in mind, there's only so much you can do about hormones.
Mm-hmm.
And you have to just sort of level out over time. But a lot of the things that honestly helped when you were a teenager are probably going to help now. Making sure that you're using a face wash that will at least help keeping your face moisturized, drinking enough water. This is like one of my top tips for the postpartum period. It doesn't matter if we are talking acne or lochia or postpartum depression or insomnia or breastfeeding or whatever. It is so, so easy to get dehydrated, especially if you're breastfeeding.
Wow.
Input, output, you are providing a liquid diet for a whole other human being. And so that is sucking a lot of the moisture out of your body. And especially right now, I mean, people can watch this episode at any time of the year, but I play furnace wars, and I finally conceded when the house got to 17 degrees on Saturday that, okay, maybe it was time to turn the furnace on, just in time for, 16-degree days. But, once we head into the fall and winter, when we've also got furnaces running, which leach so much more moisture out of the air in our homes, you really want to be focusing on making sure you're drinking enough water and staying hydrated. And that's going to help with a lot of it. It's going to help with people who experience muscle spasms postpartum. It can help with that. This is going to help with acne. This is going to help with milk supply. As Leanne has said in previous episodes, adequate hydration helps with sleep. People don't like to think about that, people being me. But it's definitely like a big factor. The other thing that the drinking water is going to help with, who knew you were going to sweat like you were in menopause after having a baby? That one came as a big surprise for me. And a lot of people that I've worked with over the years. I know I had one client years and years ago. She actually got those puppy training pads, and she put those on her bed because she got so tired of changing her sheets. And I was like, listen, if you're comfortable, that's great.
Yeah.
Like, it's a phenomenal option. But most people just change their sheets, or they put a towel down and they change that. But night sweats are a really big thing. And what really surprised me was I smelled more. Like, the body odor was actually quite a bit more pungent following having a baby. And again, hormones, because really everything is about the hormones at this point, but that's contributing to all of it too. And it's also, some of those sweats are the hormones. The rest of those sweats are all of the extra water your body retained during pregnancy. Amniotic fluid comes from somewhere. Most of you experience swelling somewhere at some point during your body. During your pregnancy, your blood volume increases between 30 and 50% in order to sustain your baby. That's all fluid that at some point has to go somewhere. And you lose some of it as part of your postpartum bleeding and your lochia and all of that. But that's not how you lose all of it. It eventually is sort of reabsorbed, and that liquid has to go somewhere. And you sweat it out. And the precursor sometimes to sweating that out is swelling.
Mm-hmm.
Swelling, this one was this huge surprise for me, especially because I was monitored very closely for preeclampsia in the final weeks of my pregnancy. I had pregnancy-induced hypertension. I was borderline preeclamptic. I never quite crossed the line, but then we have to keep a really close eye postpartum just in case. And I remember waking up the next morning, and I was all excited to be like going home that day because I don't really like being in hospitals. And I looked down, and my legs were a straight line from my knee to my foot. Like, there was no ankle, I couldn't point, like, they were so swollen. And I freaked because postpartum preeclampsia is a very serious complication. And the nurse comes in and she goes, that's normal. You were on an IV for 12 hours and you had a baby, and the fluid all has to go somewhere. You're fine. Drink some water. And I was like, okay, that's helpful, except maybe not so much, but helpful. And so again, all of this water, it is going to help you flush things out a little bit faster. That's going to make you sweat a bit more. So it's going to make
the funniest thing too, like that, when you have excess fluids in your body, the way to get rid of them is to put way more fluid into your body. Like, it just, for some reason, it just keeps that cycle going and moving really nicely. flushing that out and helping to keep you feeling better.
For sure. And that blood volume is actually something that people don't necessarily know. I think it's in a lot of pregnancy books, but it's far enough into them that people have stopped reading them obsessively every week.
Yeah.
And I don't think it gets included in a lot of like the weekly app updates. So this happens usually somewhere sort of leading into your third trimester, often around week 24, you sort of reach that peak blood volume increase. Now, part of this whole 3 months of bleeding and all of that were, in addition to it, they found, in the investigation of what was going on, they found a heart arrhythmia, which I had never had before. My father has a heart murmur. I do not. And I've never had any indications of cardiac issues. So, of course, that leads to a whole cardiac workup because, of course, everybody starts freaking out that my heart is doing funny things. And the eventual sort of conclusion the cardiologist gave me was, you had a baby. And his comment to me was that pregnancy is the longest, hardest stress test that the human body undergoes. This is a 9-month protracted, you are sustaining another human being, your blood volume is increasing. In increasing, the plasma is increasing, but the red blood cell doesn't increase as much. This is why a lot of women in pregnancy are anemic. This is contributing to all of that, is this increase in blood volume, and it puts pressure on your heart. Your heart is beating faster. Your blood pressure is different. It's lower in pregnancy, but it can fluctuate a lot more. So all of this sort of combines. You have to be aware. This is also why we're like, no, don't go back to running marathons like 4 weeks after having a baby. Your body has endured something really, really long and stressful, and it truly needs that time to heal.
Yeah.
And it's super important to sort of pay attention to those instructions because of how much your body has undergone. Now, it takes about, what did my research say? It takes about 4 to 8 weeks for blood volume to go back to normal or to pre-pregnancy levels. So this is when you'll start to see things level out. I always remember I was surprised at how winded I was after having a baby and climbing a set of stairs. I expected it when there was a baby in my lungs, but not so much when the baby was gone. But again, blood volume increase where I was, having to work with a body that was delivering oxygen in different ways to the rest of my body.
Mm-hmm.
Things to watch for postpartum, because postpartum, again, we've talked today about just some of the normal things that happen that we don't talk about. But honestly, Leanne, you and I could probably sit here for the next 4 hours and talk about all of the things postpartum that people don't know about, and we wouldn't run out of things to talk about. So, it's really hard to know what is normal, what's a warning sign, what are things you should be really, really aware of. And I'm not going to focus on the baby here. All of the literature you get focuses on making sure baby is okay, and that includes milk production. That being said, if your milk production is going really, really well and then suddenly drops off and you stop producing, that is a warning sign. Nobody told me that. In fact, I had a lactation consultant tell me that my supply dropped 5 days after giving birth because I had had an epidural. That's not how it works, folks, for the record.
No.
So, in me, it was actually an indication of this postpartum infection that was brewing. The reason for that is your body only has so much energy and so many resources. It has to divert it to keeping the body alive versus creating and producing milk. So in my case, the milk production shut down as my body and immune system geared up to fight this infection. And so that was, an indication. But that's only if your supply is really, really good. And I had probably heading towards oversupply before that happened. So it was a really noticeable and substantial difference between day 4 and day 5. For me, my milk had already come in, and then by end of day 5, it had just stopped. So that was an indication for me. But other things that are indications of physical issues, red lumps in your breast. Hot red lumps in your breast is a sign of mastitis. It's a blocked duct to start, but it often progresses to mastitis, and in the postpartum body can progress very quickly. Your immune system is down following a birth of the baby, longest, hardest stress test. So infections move fast. So lumps in your breast, Abnormal bleeding. Leanne talked about how it's dark red and really heavy with lots of clots in the first couple of days or week. And then it gets lighter, and then it gets, lighter in terms of volume and color, fewer and smaller clots until it sort of eventually becomes pinky, browny, whitish kind of discharge. If your bleeding has reduced or lightened in color and all of a sudden it comes back really heavy or with really big clots, or you go from being
bright red.
Yeah, you go from being like pinky brown to like fire engine red again. These are all warning signs that there is something going on. Now, it could just be a warning sign that you overdid it that day and you need to put your feet up and just like have a snuggle for an hour or two with baby and give your body a chance to rest. But it can also be an indication that there is something more serious going on that needs to be checked out. Flu-like symptoms are another one. You are going to feel like you got run over by a truck. I don't care how you gave birth. Medicated, unmedicated, cesarean, vaginal, it does not matter. Your body has been through something intense. It truly feels like you've gotten hit by a truck and probably run over twice. And so you are probably not going to be feeling like your best. But if you start to get those additional muscle aches, chills, fever, all of those things, and in places that you wouldn't expect, like I don't typically think of like forearms and calf muscle spasms when I think postpartum. Possible? Absolutely, especially if you're dehydrated, but not sort of the typical places where you're going to see those muscle aches, because those aren't the muscles that did the most amount of work. So if you're starting to experience those things, it's definitely a warning sign that something is potentially brewing and you really want to take a look or at least keep an eye on it. The other one, I clued in this second time around because of the abdominal pain. And it's a different abdominal pain than just had a baby abdominal pain. For me, it was on impact. I remember driving over a speed bump and thinking I was going to pass out because the impact, just like any kind of high impact on the pelvic floor, was so painful. And that was beyond the norm. If your postpartum pain is enough that you think you're going to throw up, you think you're going to pass out, those are not normal levels of postpartum pain. We expect discomfort. We expect you, if you fall behind your medication, we expect you to be in more pain, but it shouldn't be a really constant, like, I'm going to be sick from this feeling.
Exactly. I always felt like after I had babies, I felt like, when you take a grocery sack and you go to put it over the kitchen garbage can, and it's not quite big enough, but you can stretch that sucker. I felt like my vagina had done that. Like, not quite big enough to do the job, but somehow
you could make it work.
Get out and make it work. And I felt stretched out like that in the first couple of days to a week or so. So that is super normal. I also had, this is the other thing for most people experience, some kind of injury to the vaginal tissue or the perineal tissue. So you might have a tear or a cut that had to be repaired, or you might have had what we often call road rash. Like, when you skin your knee and just a little bit of the skin comes off, but not enough that you need a Band-Aid on it or something. And sometimes that can help. It's like the skin kind of abrades slightly just because there's this big baby head trying to push against that skin, maybe a nose or something, or especially if there's a hand up beside a face, that often causes that. And going pee, when you have an injury like that, almost always stings really badly. So like you might feel for a week or so that your vagina is just like a little battered, a little worse for wear. So that is normal. And so we're talking about things like stinging and achiness, a stretched out feeling. It shouldn't be sharp.
Bruising, people are surprised that they bruise.
Yeah.
I'm not sure why people are surprised by that one.
Yeah, like those are kind of like an ache, like in the ache version of pain. So if it's sharp pain, if it's sudden pain, those are big old red flags. If it's like a sort of a lingering, longer pain, that is usually normal. If it goes on more than a few days or a week after you have your baby, definitely check in if pain levels are not reducing or if they are increasing. Definitely check.
I'm also going to point out this is really important advice right now, especially with fewer and fewer postpartum visits being done in person due to the pandemic. So normally this is something that if it was lingering for any reason, your OB or your midwife would be checking in on at that 6-week appointment, and they would be able to do a physical exam to see how you are feeling. That is not happening right now. Postpartum visits are primarily being done virtually. So if any of this stuff is coming up, you aren't likely to be seeing your OB or your family doctor in the next, week or so. Not that if you think you have an infection, you should wait that long. I did that and it landed me in the hospital for 5 days. Don't do that. These are signs and symptoms that you should really be addressing quite quickly. And this is when it's, especially now when we can't just pop by a doctor or a walk-in clinic, it's really important to sort of reach out to your pregnancy care provider if any of these symptoms come up, because we are in a situation where realistically people are not being monitored as closely around these sort of issues as they might be normally. Yes. So really important to reach out. Now, we sort of got onto this topic of pain, and this leads into one of my, sort of the tips of here's your hope, how to make all of this a little bit easier. I know a lot of people have this idea of like toughing it out and don't want to need medication, especially people who don't utilize medical pain relief during labor. There's sort of this, I got through labor, why would I need this now? So like doula real talk for a second, take your meds. Take both meds. They want you to take
There
both.
are no heroes. No heroes after you have a baby.
And in fact, not
soldiers.
In fact, not only are there no heroes, not taking painkillers and anti-inflammatories following the birth of the baby can actually prolong your healing. It's sort of counterintuitive in some ways because people are like, well, I just need, this is what my body does. My body is supposed to have a baby. My body is supposed to heal from a baby. Well, yes, but you don't have to do it miserable, and you can do it in a way that actually is healthier for your future body, future pregnancies, all of that. And controlling pain and inflammation is a big piece of that. Surprisingly, controlling your pain and inflammation also helps your milk supply. Just like I mentioned earlier, if your body has to divert resources to multiple places, it can't do its full job when it comes to creating and building a breast milk supply. So staying on top of your pain meds is really important here. Just like as doulas, we will tell our clients in labor, it is a lot harder to catch up to pain that has gotten out of control than it is to stay ahead of pain. You don't want to fall behind if you can help it in the first week or so. That might mean setting alarms so that you take your meds right at that 6 or 8 hour mark, whatever you've been told based on the med you're taking. And usually you're taking ibuprofen or a stronger version of ibuprofen and acetaminophen. You're really looking for just sort of mild pain relief and a lot of really good anti-inflammatories because you just pushed a baby out of your vagina or had major abdominal surgery. And both of those things trigger an inflammatory response in the body. And we want to control that because the more inflammation you have, the harder it is for things like perineal tears to heal. The tissue swells. It's not going to heal in that state. So you've now prolonged the healing of a tear or an episiotomy. You don't want to do that. So stay on top of your meds, stay ahead of your pain. On top of that, especially in the first couple of days, ice packs on the perineum can be really helpful. They're only helpful to a point. After about day 3 or day 4, they actually start to prevent the tissue from healing as well. Even if it hurts, it's probably not so helpful to use an ice pack at that point. But all of those things, also some hospitals can give you a lidocaine spray if you've had stitches. That can just help ease some of the discomfort, especially as those stitches start to dry out and heal. That can remove some of that. And Leanne, you talked about the abrasion and how urinating can be stinging. Can you believe I didn't put a peri bottle on my list of things that will help? Clearly I had a brain fart. Peri bottle is like a sports water bottle. Every hospital will give you one if you are giving birth in a GTA or an Ontario hospital. And you fill it with warm water and you aim it at the vagina and at the whole sort of vulvar region while you are urinating, and it helps to wash away everything, including sort of the acidity of the urine, and can help to really ease. And then you just sort of pat dry instead of wiping. That helps those abrasions and those sort of splits and micro tears and all of that to start healing, and also provides some relief from that stinging. And another piece of that is the sitz baths for people who would like them. These are recommended for those who have had vaginal births, and you can either use the ones in the toilet, although I will tell you that people who have significant hemorrhoids following the birth of a baby find toilet sitz baths to be uncomfortable because of how far they need to drop their bottom. So for those people, just sitting in the tub is sometime, and filling it with just a couple of inches of water is sometimes the more comfortable option.
Sitz baths, though, also, they usually come with like a bag, like a hanging bag and a tube, and there's a notch in the little sitz tub so you can set it up so you've got like a big bag full of warm water with Epsom salts in it, have the tube in the notch, and then the tube sort of sprays up onto your perineum as if it was like a bidet, so that's one way if you want to use the toilet version, and you can grab those at Walmart or Shoppers. I'm pretty sure I still have mine from 17 years ago.
I just use the bathtub.
Yeah, and that's the other thing. I had a client who said, I have a removable, like a handheld shower, and I just pop in the tub and spray with the shower head while I pee, and that was the most comfortable thing. She got more water than the peri bottle was able to give her, and she could just keep spraying afterwards, and there was plenty of water, nice warm water, and she could adjust the water better than try to guess while hitting, sometimes I use those peri bottles, and I've done it actually recently, and sometimes if you get the water too hot, it is a bit of a shock.
It hurts.
And if it's too cold, it's also a bit of a shock. Although I'm one of the people who just got a bidet this year to combat the problem with toilet paper. And it's not heated. It's very bracing. It's refreshing.
Bracing is one word for it. It's going to be very bracing in February, Leanne.
Oh, Lord, it is. Yeah.
I had a couple of other tips. Two are often a bit of a surprise to people. The first is continue taking your prenatal vitamins.
Yes.
Just because you are no longer prenatal doesn't mean you want to stop these. These are really good. And I actually typically suggest people obviously talk to your doctor about what's right for you. I am not a medical care provider. That being said, generally speaking, most care providers I have spoken to over the years recommend continuing your prenatal vitamins as long as you are breastfeeding, or if you are planning another pregnancy, you might as well just take it and continue taking them after you finish breastfeeding prior to becoming pregnant again, because you do want the folic acid, and you would be taking folic acid leading into another pregnancy anyways. Typically speaking, it is considered that it will take up to 2 years for the human body to replenish all of the nutrients and minerals and sort of all of that in the body following a pregnancy. Continuing to take your prenatal vitamins can help that process by adding some of those nutrients and minerals back in a little bit faster than you would get them through sort of everyday diet. So it's a really helpful thing. It can help a little bit, a teeny tiny little bit with that hair loss. And with the, any skin issues and acne, taking those, it's obviously not replacing the estrogen, but it's helping a lot of the other sort of deficiencies in your body. Mm-hmm. The next one, cesarean birthers will totally recognize this one. Walking, gentle walking. Nurses are going to tell you to get up literally as soon as you can feel your feet again. There's a reason for this. It actually helps the circulation and promotes healing. This is true if you had a vaginal birth as well. However, the antithesis of healing is stairs. Doesn't matter how you gave birth, avoid the stairs as much as possible, especially in the first 2 weeks. If that means you sort of come down in the morning and then camp out on the main level for the rest of the day and then go upstairs at the end of the day, that works. That's great. Minimize as much as possible. But those gentle sort of walks around the block, either wearing your baby or pushing the stroller without a lot of other stuff in it, so it's not too heavy, that's really good and is going to start the healing process for you. Now, although I just told you to go for gentle walks, there is a reason so many cultures in our world have some kind of postpartum lying in period. The one most people are familiar with is sort of in traditional Chinese medicine, this 40-day lying in period. China is certainly not the only country who has this tradition and this sort of cultural practice, and there is a reason for it. That first 6 weeks, your body is undergoing so much healing, and it's really important to give it the time to do that. So this is where really good, healthy food, keeping adequately hydrated, staying on your prenatal meds, taking, resting as much as you can. I hate the phrase sleep when baby sleeps because there are still dishes and laundry and, me time, but sleeping whenever you can. This idea of a lying in period, we don't really have it. We have more of it in Canada, I guess, than the US does. But even here, we have this idea that moms are going to be like up and about and bouncing back within days. And I will admit I was fully guilty of it. I remember grocery shopping 36 hours after having a baby. Dumb move. I am the poster child for don't do what I do in the postpartum period, which is why I think I'm so passionate about really recognizing your own body and your own needs outside of having a baby in the postpartum period, because I was the poster child for neglecting those needs, and I paid for it both times.
Thank you. Thank you for doing the research, the primary research, in order to do that.
Yeah. I did it the hard way. So you all can skip that part. This is something I've been passionate about for a really long time, because we don't tell new parents what their own bodies are going to be doing following having a baby. And I will say, we didn't even touch on mental health today. I feel like that's a whole episode in and of itself.
I know. I think before we end, my last thing, I want to talk about pooping a little.
Oh, yeah. I figured I almost poop is its own episode.
So when you go into labor, again, so Meaghan, you were just telling us that your body can only do so many big deal things at one time. And one of the things that happens is literally your body, when your uterus starts working like real hard to bring your baby down and push them out, and of course open up that cervix and everything. So the uterus is doing this. Your body literally sort of shunts blood flow away from your bowels. And so your bowels are like, oh, I guess we're on vacation for a little while. Awesome. And they just kind of stop working effectively throughout labor. Now, of course, we know that when you push a baby out, sometimes a little poop comes out as well. For most people, you're not actually having a poop. Really, what's happening is stuff gets scraped out. It's just like, I don't know, the batter in the bowl, and as the baby moves through.
That is the mental image I'm going to have for the rest of my doula career, Leanne. Thank you very much.
I'm sorry, I'm the queen of gross analogies. So yeah, it's like just a little bit, or like the last teensiest bit. I always say when I'm teaching this, I say, it's like when you go, oh shit, I'm out of toothpaste, but you can always squeeze one more application. And then the next day you're like, ah, damn it, I forgot to buy toothpaste. You can always get one more out of there. So that's kind of like what it's like. It's not like you're having an actual poop, because your bowels are not like massaging the contents downwards and pushing them out. So when your body does kick back into going poop, within about 24 hours it happens. And most hospitals, if you're in the hospital for that 12 to 24 hour after birth period that they like most people to stay for, they're going to like try to get you on the toilet. They're going to try to get you to have a poo if at all possible. And what you're going to notice is that the poo is going to have a weird consistency. It's going to be quite firm, quite solid, but also quite sticky. And it's going to have a very distinctly weird smell. Like, that's the one thing that I was like when you don't go to the bathroom for a really long time, when you finally go, it's like your bowels do some funky thing. I don't know what it is. Maybe it's the chemicals are just sitting longer than they normally would, but there's a weird smell to your bowel movements. So be aware of that. And then, of course, you know, if you've been pushing, especially if you had a really long pushing phase, you're probably also, not only is your vagina going to feel like it got stretched over a bin, your butt is going to feel like that as well, because there's a lot of pressure down into your rectum. So it might feel really awful to try to have a bowel movement. And you may feel like you're going, if you push at all, you're just going to blow your whole butthole open. And we don't want you to feel like that. So, number one, eat as much fiber as possible. Like, grab some apples and stuff. Like, if you normally say would order a pizza or something for like an easy meal, try to like get someone to bring you one of those pre-cut things of vegetables and fruit from the store and just graze on that all day long as much as you can. You need a lot of like just like fiber, pure fiber in your body, a lot of water. Drink a lot of water to help move that fiber through you. And then when you go to the bathroom, grab a nice wad of toilet paper. And if you can reach, I realize stretching might not be easy for you, but if you can reach, push on your bum as you start to sort of push down to poo.
I've told people to use warm washcloths. I often recommend a warm washcloth instead, especially if you have stitches, because I remember feeling like my stitches were going to burst.
Yeah.
That was it for me. I was like, my stitches are going to burst and my vagina is going to fall out.
Yeah. And it really, I mean, it just feels like that. None of those things are going to happen.
Yeah, but it felt like it. So I actually used a warm washcloth to just have that sort of perineal pressure. This is also really helpful. People don't know labial tears are a thing or clitoral tears are a thing. They are. And often they aren't stitched because of where they are. It's not necessarily an easy or good place to put stitches. So even just having that warm washcloth can, again, help some of that, prevent some of that downward pressure on those areas. And so it can just all help with that. Leanne, I really do think we need to do an entire episode on poop.
We probably do, and probably a whole one on stitches and
yeah. But poop is everybody worries about pooping in labor and pooping after having a baby. And I think we just need to do an episode on poop. Maybe we'll do that. Maybe we'll do like a Christmas poop episode. Maybe next month we'll do a poop episode. But I hope everybody found this helpful. I'm sure we will revisit this topic in the future because there are so many things to be aware of with your own body and all of that following having a baby. As I said, we didn't even touch on mental health today. That is probably a series of episodes in and of itself. Hopefully these tips were helpful. If they were, please feel free to share them, spread them. The link for our newsletter is in the comments or scrolling along the bottom of your screen. You will get a replay of this video as well. Leanne makes some really, really fantastic printables and top doula tips. We have recipes and book recommendations and what are we doing and all of that information out there. If you are newly postpartum or expecting a baby really, really soon and you watched this episode and went, oh my gosh, I don't know what I've signed myself up for. This all sounds very overwhelming. I am terrified. all three of our agencies are currently providing postpartum doula support. Hospitals and birth support is obviously a bit iffy these days, but all of our agencies have undergone sort of training modules and COVID policies and protocols in place to keep both our doula teams and our clients safe. But we are providing those services, and that means that you get sort of all of this information directly from the doula's mouth or the expert's mouth. The doula can be there to talk through all of this. I probably look a little tired because I've been doing overnights, and I will be honest, a lot of today's conversation has come out of conversation that I have been having with the overnight client I'm working with, because she was surprised by a lot of these things. And it reminded me how many people are surprised by a lot of these things. So our doulas are available. They are here for you if you need them. Obviously, reach out to the agency that is in your area. So Toronto Family Doulas, Hamilton Family Doulas, or Family Doulas of Ottawa. And we will be happy to hook you up with that support and that expertise.
Absolutely. Join us next week, please. I will be talking about due dates, all about due dates. And then the week after, we're going to be talking, we're going to have Meaghan from Ottawa talking about dealing with and preparing yourself for an unplanned cesarean birth. And then the week after, we're going to be talking to the fantastic folks at Myofacial Mississauga. We're going to be talking about C-section scars, what you need to know about those. So it's a great month. If you have any questions you'd like to ask us, feel free to drop them in the comments. If you have an issue that you want to learn more about, though, if you have a suggestion for a future episode, then please let us know. Honestly, we have the Myofacial people who are coming this month. That was a suggestion from a viewer. We have another show next month where, again, it was a suggestion from a viewer, and we're going to have a guest in to talk about stuff. It's really quite awesome. So as Meaghan said, if you do not subscribe to our newsletter, subscribe. And we'll keep you in the loop on what's going on. You can also find us on Birth and Baby Talk on Facebook, where you're watching this. You can find us Birth and Baby Talk on Instagram, and of course on YouTube, where this will go to live forever and ever to help not only you, but all the families who are about to have babies. So thanks for joining us, everyone. I'm Leanne from Hamilton Family Doulas. Meaghan, thank you for joining me. And we'll see you all soon.
Bye.